Friends, what happens to our ligaments during knee replacement surgery? This question is asked by many people to me. So there are four ligaments, you know that. ACL, which is in the front, PCL, which is in the back, MCL in the inner part, LCL, which is outer part. Whenever we do knee replacement surgery, this inner ligament MCL, outer ligament LCL is not damaged. We should not damage it. It will be retained. It will help giving stability to the knee joint from inside and outside. Means whenever the leg is going like this outside, this will prevent it opening from inside. This prevents opening of the knee outside. So we don't damage MCL, we should not damage LCL. So then what happens to ACL? So ACL will be cut and removed in all knee replacements. ACL is not retained. Then what happens to PCL? Behind. Some of the designs we retain the PCL. These designs are called as cruciate retaining knees. Means this helps in giving stability to the anterior, posterior, and means front and back. This PCL, this ligament doesn't let the leg to go behind when person is climbing stairs or getting downstairs and getting up from the chair, and giving stability to the knee joint. So we will not damage this PCL in some of particular designs, which is called as cruciate retaining knees. Some other types of designs are called as PS knees, posterior stabilized knees, PS, where there is something called CAM. This is called post, tibial post. There is a projection here, and there is something called CAM. This is called CAM. This projection and this CAM work like this. This projection and this CAM, this doesn't let the implant go behind. This gives stability. That's why it is called as posterior stabilized design. Because of having this post and CAM, the leg doesn't go below. This works instead of PCL. Whenever we remove the PCL, we have to use this type of design. This post and CAM gives stability to the knee in the behind where the PCL was there before. If we remove the PCL, when we have to do the box type of cut, this box type of cut, this is called as a box cut. This is called as a box. If we retain the PCL, that is CR knees, cruciate retaining knees, there is no box cut. PCL will do the function of giving stability to the back. So in PS knees, we remove the PCL. In CR knees, we retain the PCL. That's why it is called as cruciate retaining knees, whereas ACL is removed in all type of total knee replacements. Thank you.